Okay, it is 1600 UTC, 7 p.m. here in Moscow, and whatever. Good morning, good evening, good day, everybody. Hello, and welcome to our webinar on treating trigeminal neuralgia using coMra therapy. Trigeminal neuralgia is exceedingly difficult topic to experience, to talk, to discuss, to treat. It's a huge topic. So this is the key reason why we decided to put this webinar together. So my name is Arzhan Surazakov. I'm Director of Research and Development at Radiant Life Technologies. And the trigeminal neuralgia topic has appeared on our radar very early, since we introduced coMra therapy in 2010. This is the technology that we'll be talking today about mostly. So I myself never had trigeminal neuralgia, but my aunt did. So, okay, I can see somebody's waving, so some of you have trigeminal neuralgia. So I never had the experience myself. My aunt had, and when she shared how much pain she had, and she was screaming with pain. So she was diagnosed back in 2009, and at the time she was hospitalized, and medication did help for a certain time, but eventually they had to let her go from the hospital. And at the time, her neurologist recommended something called low-level laser therapy. So in 2010, she tried it and really helped her. But she had to travel quite a distance to find a specialized treatment center. So in 2010, late 2010, when we introduced coMra therapy, my aunt was one of the first users of coMra devices here in Russia. And she used it at home, and she was so glad that she got it. She used it, and over several years, it was a long journey, she felt better and better. So that was the very first pointer, that we have here something here. It's really curious how it works, the pain relief effect and the gradual recovery that we have seen in users. So these experiences over the years kept coming in. People with trigeminal neuralgia would show up on our radar again and again. So this is eventually, we are today. And we decided to put this webinar together to basically, let's share our experience. It's exceedingly difficult topic. It's exceedingly painful condition. But then let's come together. Let's share what we have found out. And this is how the idea has come up. So I would like to acknowledge all the questions that we received from the Facebook group, Trigeminal Neuralgia Support Group. We also received more than 100 questions from enrollment form. So I would like to acknowledge each question that we received from you. And today we'll try to do our best to cover as much as possible. But we did realize that, the topic is so big and we have such interesting material, we decided to split into 2 webinars. So today, November 1st, we'll have 2 presentations, and then November 15th, we'll have another 2 presentations, the second webinar. Okay, and just on a side note, for those of you who are attending live, please type your questions in a chat box, and we'll come back to your questions at the end of the webinar. And then again at the second webinar, we'll cover more questions as they will be coming up to us. Okay, so I'd like to thank our Facebook team, Patricia, Milen, Nevena. You've been there for many years, providing the space for people with trigeminal neuralgia to express, to share, to acknowledge each other. So thank you very much for all your support. And today, let me show you my screen. We have very, very interesting speakers. I'm talking about Leslie, you, first of all. But let me show you my slides first. So, in the first part of the presentation, I will talk about the core idea of our technology, which is about regeneration of trigeminal nerve. I'll talk about how it's possible, and most importantly, why we need to think about regeneration. And the second part of the webinar Leslie Carmen, she will present her clinical experience of using coMra therapy at her clinic in Florida. And I believe Leslie used it since 2015. So she had lots of very interesting experience. So let's get to it. Yes, and the announcement about the second webinar. On November 15th, Dr. Arzhan Surazakov, she will talk about coMra experience from coMra Center here in Russia. Also clinical experience for about 3 years working with different types of neuropathy, including trigeminal neuralgia and Bell's palsy as well. And then in the second part, on November 15, Garrett Murin, he will talk about practical aspects, specifically which devices to use, how to apply them, the protocols, and the holistic approach in general. So that's our plan. So I will start with my presentation on regeneration of trigeminal neuralgia. So first of all, when we talk about trigeminal neuralgia, again, I will cover a few points that I'm sure most of you already know, but I feel it's really important that we start from really the basics, so we can start from the same sort of same starting line. So when it comes to the trigeminal nerve, and as you can see here on the left, it's the biggest, largest nerve that collects sensory information from face, from skull, and relays it to the brain. So when we face the world, so to speak, this is how we sense the temperature, the touch, and pain. So electrical signals travel from the nerve endings, from each of the nerve, and they travel all the way to the brain stem. And we'll talk about why it's so important. As you know, there could be many different causes for trigeminal neuralgia. Very often, doctors now, they say, it's compression. Like, for example, when a blood vessel is pushing against the nerve is irritated, hence the pain. There could be accidents, trauma, toxicity, infection, like, for example, herpes infection, or psychological stress, and many other causes. But what I really want to emphasize here is that regardless of the type of the injury of trigeminal nerve, we end up at the same point, which is injured nerve. So, and this is the key idea. Why? Because pain is a symptom that the nerve has been injured. So when it comes to trigeminal neuralgia, we're talking about basically a nerve that has been injured and now it's functioning not normally. So very briefly, what are we talking about? What is trigeminal nerve, how it looks like, what is injury? So again, really some basic notions, but I would like to share with you some of these points, because once you understand them, you will see how coMra therapy works and why it's so important to talk about regeneration. So nerve, if we put it very, very simply, is a bundle of individual fibers. Like, for example, here you would see this is an individual fiber that conducts electrical signals basically along its length from, let's say, from the skin all the way to the brainstem. Now, several fibers are bundled together in a cluster, and several bundles, again, organized together as a nerve. Obviously, you will see the blood vessels carrying blood, you will see other supporting structures, but basically when you look at the nerve, and here we're looking at the cross-section of the nerve, it's a highly organized structure. So what happens when we injure the nerve? Well, let's see a bit closer. This is a photograph under microscope of a nerve. And here you will see this yellow circular coverings or wrappings around the bluish ones, what it is. So the yellow is like electrical isolation on a cable that you typically know, because the main function of the individual fiber is to carry electrical signal. Well, because we need to carry it for a long distance, that signal will be dissipating if it's without isolation. So each individual fiber is wrapped in a protective sheath. Maybe you heard about the term myelin sheath. So this is what a healthy nerve looks like. A lot of individual fibers wrapped in this protective myelin sheath. What happens if we injure the nerve? Let's look at the individual nerve fiber and what happens when there is an injury. So on top here, we have a healthy nerve. So in yellow color, we see the conductive so-called axon. It's like a tentacle from the neuron body that extends all the way from the skin to the brainstem. And here we have the protective myelin sheath. In case of injury, like for example here as shown, we see a compression. When there is compression, let's say due to blood vessel or mechanical injury, the nerve, in this case individual axon, is squished, it's damaged. So what happens is that we end up with the partial injury. In other words, the nerve cell is still alive, but it is damaged. The protective sheath, you can see it here, is squished, it's losing its thickness and no longer functions properly as a protective isolation. So a damaged neuron is now firing very rapidly signals that are not supposed to be there. That's because the cell is damaged. The term is hyperexcitability. Now, what happens if the injury is significant? Or let's say, it happens over the long time. Eventually, what happens is that the neuron loses completely its ability to conduct electrical signal. This is when we lose completely sensitivity along this nerve. So at this stage here, at this stage, the nerve could be still alive. This individual fiber could be still alive, but it's no longer functioning. It's destroyed to such a degree that it is no longer functioning, complete loss of functionality. And again, this is the final stage over here, is that, when injury is too much for a cell to sustain, or if there is damage has been happening over a very long time, we observe a complete disintegration of that particular nerve. So this is a progression, of the process, what called sometimes a degenerative process. So we began with something, we began with a healthy neuron, with a healthy cell, and as damage progresses, we have, first of all, pain. In case of trigeminal neuralgia, it would be pain attacks, because here, once the nerve is partially injured, it would be susceptible, it will be hypersensitive. So whenever there is irritation, the nerve would fire a long string of these electric impulses, which we perceive as pain. But what are we talking about? Let's look at more detail. What is hyperexcitability? So this is a recording of electrical charge in the nerve when they actually place the electrodes next to the nerve and measure how the nerve is actually sending those signals. So here in the red, you see this is a moment of injury of the nerve. Let's say they poked the nerve, the trigeminal nerve. So this spike in electrical activity is what we would expect. A nerve reports a pain sensation. There is a spike in the voltage. But these spikes here, and here, and these ones, are not so-called normal or healthy response, because now nerve is damaged and it's producing these spontaneous electrical signals that actually no longer a proper response to the initial injury. That happens because the nerve is now injured. So what happens? Let's look eventually at the progression of trigeminal neuralgia. We're looking now at a sample of tissue for a trigeminal nerve from somebody, a male, 61 years old, and he had trigeminal neuralgia for 4 years. So when they took a sample from his trigeminal nerve, on the left you see a cross section. So this black ring, this is the protective cover that surrounds the axon. This is the conductive part. So here would be the axon, and here's outside is the ring. So on the left you see a part of trigeminal nerve, those fibers that are still preserved, they are intact, as a healthy axons. On the right, like for example here, you see the cross section of an axon of a particular nerve fiber, which lost its protective cover. And here, there's almost none of myelin sheath, and here as well. Why this is important? This is important because once the individual nerve fibers lose their protective sheaths, the electrical charge is now jumps from fiber to fiber. So what happens is that, let's say, some of those fibers report only a sense of touch. When we touch our cheek, and they do their job, they're just sending electrical signal that there is somebody touched our cheek. Let's say this particular fiber sent a signal. But what if this fiber is responsible for pain sensation? If electrical charge is now leaks here into this neighbor fiber, which is responsible for pain, now we can perceive a gentle touch as something extremely, extremely painful. And that happens because the protective myelin sheath has been destroyed for whatever reason. Again, we'll come back to that. But at this particular case, it's not here. So what happens? What do we need to do to treat trigeminal neuralgia? So this is how my current understanding. So obviously it's a developing field of knowledge, and as I learn, as we learn together as a group, this is what I see at the moment. What are the treatment options out there? And I received, I don't know, maybe at least 20 questions asking about different treatment options, and is surgery the only options? Is drugs only options? Is there something else beyond these two most common options? So let's look at this big picture. First of all, medication. For trigeminal neuralgia, the medication basically works here. It suppresses the activity of neurons, those nerve cells, to fire electrical signals. In other words, with medication, we're trying to suppress electrical activity of nerve cells. We are trying to push down those spikes. It could work, especially when pain is so strong. Obviously, this is where we start. Very often we go for medication. Other options, let's, for example, MVD surgery, when they try to decompress the nerve from blood vessel, which is nearby. So we will be addressing a cause, which is, in this case, well, some people have, when the nerve is being compressed. If there is infection, we can address the infection, and we should address the infection. If there was a car accident, a trauma, for example, then obviously, already happened, you can't do much. But if there is also toxicity, if there is emotional pain, to which I come, we need to also address this as well. But what about the injured nerve itself? You see, if we suppress pain, if we resolve the cause of injury, we're still left with injured nerve. Therefore, the key idea that today we will talk about is, let's regenerate the nerve. And once it's regenerated, very naturally, the pain will subside. Well, that's the proposition. That's what our current understanding. And Leslie will give you some really exciting examples of that. So what I'm talking about when I'm referring to coMra, how we are regenerating the nerve. So coMra therapy is a technology that combines 4 non-invasive, non-destructive radiances. So here on a photograph, you see a device called coMra Delta. It's a small handheld device, and it combines 4 radiances: low-level laser, magnetic field, ultrasound, and color LED, or phototherapy, as you may have heard about it. So this is the coMra therapy. This is a technology that we have been using to treat trigeminal neuralgia. And the main action of this technology is very different from surgery, from medication, or from high-intensity radiation. Like, for example, some of you may know something called a gamma knife surgery. You see, gamma knife surgery and other types of radiation is a very intensive, high-energy technologies that partially destroy the nerve. With coMra therapy, we're not attempting to destroy the nerve, we are attempting to support its natural regenerative process. So here what I'm showing is that there is cell regeneration. It's a natural process that happens in the nerve all the time. How do we know about it? Well, it's very simple. Maybe you heard that when some patients select to do gamma knife surgery, and the pain goes away, but then it comes back again after a few months or maybe a few years. Why it's coming back? It's coming back because the nerve regenerates. The problem is that it regenerates incompletely, hence the pain. You remember the partial destruction. So cell regeneration happens all the time, but the problem is that it's incomplete. So what we want to do is to provide conditions with these 4 radiances so that the cell can regenerate itself much more fully. And as a result, we have a normal cell function. Well, in this particular case, it will be a normal function of the trigeminal nerve. How do we know it works? Just one brief example. On the left, you see the recording of the trigeminal nerve that has been irritated. Here is the injury, the moment of injury. And then we have here spikes, and then you see these spikes every time, These are the spikes that are produced by irritated, damaged nerve. Now, when we apply, in this case, low-level laser, which doesn't destroy the nerve, it only helps the nerve to restore its functionality. Same conditions. So here is the moment of irritation. But now after treatment, the nerve behaves normally. Well, you can see here is only one spike and then normal background activity of the nerve. So actually, there is so much research done, and I don't expect for you to memorize this slide, but there is so much research has been done in terms of action of low-level radiances like laser therapy, magnetic therapy, phototherapy, ultrasound therapy that helps to rebuild the nerve. There are dozens of clinical trials, and here in Russia, low-level laser therapy or a combination of two with the magnetic field and now coMra therapy is actually recommended by neurologists to treat trigeminal neuralgia, but that's not the case in the countries elsewhere. So in a second webinar on November 15th, Dr. Arzhan Surazakov, she will talk about her clinical experience both in the hospital and in a private center of using these modalities. So I really would like to jump now to Leslie and for her clinical experience, but before we do that, there is one key slide that I really must share with you because I feel it's so important for all of us to really understand and acknowledge trigeminal neuralgia, why it is so painful. You see, the brain is a vast, very complex structure, and there are different parts of the brain that are responsible for speech, for vision, for memory, for movement, and so on. But when it comes to pain, it seems to be no particular part of the brain which is responsible. But until very recently, they discovered that there is actually brain stem. This is the most ancient and fundamental structure in our brain, which is responsible for breathing, for heart rate, for our consciousness. So that part of the brain also assembles our experience, our conscious experience of pain. So whenever signal comes, let's say, from the leg, from the arm, from abdomen, it arrives eventually to this processing center and we perceive pain. But in case of somatic pain that comes, let's say, from the finger, the signal has to travel through multiple connections before the signal arrives to the brain. And this is why we can take different medication, usual painkillers, and we can successfully address it. But when it comes to trigeminal nerve, in red, you can see it here, there is only a single connection from the trigeminal nerve directly to the brainstem, to the pain processing center. There is no intermediary. This is why all the sensory input, and especially pain sensation from damaged trigeminal nerve, is so acute. And this is why the common medication, the common painkillers do not work. And there is very interesting bit about very intense psychological stress and specifically painful emotion. They also have direct impact on the same center. It may involve memory from childhood, some childhood trauma. It could be a relationship in your family with somebody who's close to you. It could be at work. But whenever we experience very intense feelings, thoughts, but they're so intense that we actually register them as pain, they're also being assembled in the same spot in the brainstem. This is why when we talk about trigeminal neuralgia, it's not just only trigeminal nerve which is damaged. We also need to think about our entire state of being. And obviously, because our central nervous system is completely engaged when we experience pain, it affects all our systems in the body. And this is why we need to address trigeminal neuralgia truly holistically and not just from one angle. So our vision for trigeminal neuralgia, for chronic pain, is very simple. What we have discovered so far, and Leslie will share with you, is that we want to support regeneration and restoration of wholeness. That's where we're heading. That's where we believe it's most needed way to go. And it needs to be done at all levels. Physically, we need to regenerate the nerve. Emotionally, we do need to address emotional pain, and mentally. And we can do this through coherence, which is the same through harmony. So all our work at Radiant Life Technologies and the Institute for the Study of Man is around this concept. And again, in the second webinar, we'll come back to that. Okay, thank you for your attention. And I sort of provided a background for the Leslie to share.
Arzhan, just before we move on, if I could just touch on 2 points.
Yes, please, Gary.
Because I feel they're really important. When you get that hyperexcitability, that's one of the issues going on for people. And then the other one is the crosstalk between, because the myelin sheath. Just to reiterate that so people understand it, in the sense that the sensation crosses over because there's no, as Arzhan pointed out, no myelin sheath. That crosses over into the neuron that signals pain, the other pathway. So now you have all of this. You could picture many conversations that should be traveling along a different wavelength are all of a sudden now on the pain wavelength. So that's why any input whatsoever is so agonizing with trigeminal neuralgia. And then to go with that too, where there's no junction, as Arzhan was saying, the regular pain medications stop things at different junctions, we'll say, in a matter of speaking. And because there's no junction, there's no way to stop that pain signal from getting to the brain. And then with that regular anti-convulsant drug, anti-epileptic, is really just dampening the signals that are arriving to that, what Arzhan circled there in the middle, the really the center of the brain, there, the pons and the midbrain. And then what I also wanted to mention with that, Arzhan, is, and I don't know if you wanted to talk about this at all, but there are some studies that talk about that part of the brain starts to atrophy because it gets so, it kind of has to, because there's such an overload, it has to start shutting itself down to manage it. But then when it shuts itself down, it's saying, okay, I'm not going to use my arm so I don't feel any pain. But then when I don't use my arm, the muscle starts to waste away. It starts to atrophy. I don't know if you wanted to speak to that or if it's a bit superfluous to the talk, Arzhan, but I just wanted to mention it.
I gave example of degenerative process. When here, for example, we talk about only the axons of these, the tentacles, so to speak. But you are absolutely correct. When they did a very detailed studies of people with trigeminal neuralgia, with MRI, with other very advanced imaging technologies, they found that the brainstem, this is the part of the brain that processes pain, plus root of the trigeminal nerve atrophy, it actually shrinks by 20, 30, 40%. So instead of the bundle of healthy, strong nerves and neurons in the brain, what we're observing is that they shrink. And that's, really the issue, because when we talk about, the need to regenerate is, that's the key. And sometimes, when I think about pain relief, I totally maybe understand. I never had trigeminal neuralgia, but I can relate in some way. If you're in such pain, you want the pain to stop. And that's what, we go for medication. But unfortunately, that leaves the issue of atrophy, of the degeneration, unaddressed. So thank you, Garrett. I feel it's a hugely important point that we're talking about, injury, degeneration that happens in the nerve, but also in the brain. So what we're aiming at is to rebuild it, help it to restore.
Yeah, and I also wanted to just bring that up. Thank you for touching on that. Just in the sense, well, not just, but in the sense that one of the things with the trigeminal neuralgia treatment, and we're not doing that today, but just to come back to it when we go to the next webinar, is along the lines of, okay, we actually need to treat that midbrain part of the, not just the nerve root, but also where it emanates from the midbrain, in order to facilitate this regeneration and restoration.
Yeah, absolutely good.
Yeah.
And
okay,
we'll
well, thank you, Arzhan. Yeah.
We can do it. Thank
Sorry,
you, guys.
what was that? I interrupted what you say.
We'll talk about it more. The treatment protocol. Okay, Leslie, would you like to go with your presentation, please?
Absolutely. Thank you so much, Dr. Arzhan, Garrett, Avril, and to the whole Radiant Life Technologies team for putting this webinar together. It means so much to me. Also, that you're supporting the TN community. It's amazing that you're raising this awareness. So thank you for that. And also welcome to everybody who is here. It saddens me to know that you're here, because that means you're suffering with trigeminal neuralgia, or you have someone who suffers. But I believe that after this webinar, you're going to walk away with so much more knowledge, with a deeper understanding of this disease, but most of all with hope, because there is hope. And that is so important for you to know, that you're not alone in this. We're here for you. This Radiant Life Technology community is here to help you. We're all here to help you. And I'm very excited on that note to give you the experience that I've had in the clinic, and to share with you some of the cases and some of the knowledge that I've learned over the years. So if you don't mind, the next slide, please. Leslie Carmen is my daughter, and when she was 17 years old, she went to a ice hockey prep school in Lake Placid, and she was playing there on ice hockey every day, having a great time, being a young teenager. And one day, out of the blue, she was sitting and she had a cup of ice that she bit on the ice, and then she afterwards had a hot fry. She bit on that, and instantly she got a shock. She had no idea what it was. She didn't know where it came from, and she just had excruciating pain for just a few seconds. She didn't mention it to me at the time, but suddenly over the next few days, she would feel this intense shock pain, and it would be just for a few seconds. But then within weeks, it developed to be more and more and more intensive, until she would start waking up at 3 in the morning with excruciating facial pain, screaming. She wasn't with me. She was in her school at that time, so I really didn't know much at the time what was going on. She would wake up and just throw herself to the floor, screaming, holding her face. And then she would, after about a half an hour, her attacks would last a half an hour, she'd just, go to bed and just completely fall asleep for several hours from the pain. She then started to tell me, she didn't want to upset me. You know how children are, they don't want to share what they're going through. But she called me and said, Mom, this is really escalating to something bad. I'm really scared. This is excruciatingly painful. And the school was trying to help bring her to dentists and was trying to bring her to other doctors. Nobody could find a solution. And one day the pain escalated so much that the school had to take her to the emergency room. We were living in Florida, so we took the next plane, flew up there, the longest flight of my life. We finally get into the emergency room about 10 o'clock at night. And they had been doing tests and tests and tests, and she had been given so many pain medications, and she was still in pain. The doctors came in and handed me a letter saying that your daughter has been diagnosed with trigeminal neuralgia. Today I realize how fortunate we were that they were able to diagnose her fairly quickly, because so many people come to us and it has taken them years to find a diagnosis. So I was very fortunate in that instant. But what really scared me more is I didn't know anything about this, right? But what scared me more was they gave her a very heavy-duty pain injection. I don't know what it was at the time. And they said, this will last her for 24 hours. Take her back home to Florida and see a neurologist as soon as you can. They said, this is not a disease that she's going to die from. However, it is the most painful disease known to mankind, and you need immediate attention. So very scary for all of us. We went to the hotel room and my daughter went to sleep. I was, of course, on the computer researching. I could not fall asleep. What is this that she has? What can one do? There's got to be a solution. And this is the scary part. At 3 o'clock in the morning, she woke up screaming with pain. And it was the first time that I had actually seen her and experienced this. And it was horrible for her and for our whole family. And within a half an hour, her pain stopped and she just went back to bed, was just out. And that's when I realized what I'm dealing with. This is a monster of a disease, because the doctors just told me that this pain medication was going to last 24 hours and it didn't last more than 4. Because unfortunately, some of the TN pain is unresponsive to pain medication. Now, some of them are, but on a very many people do not respond to any kind of pain medication. So we took her home back to Florida, and I immediately started researching. She went to a neurologist there, but unfortunately his answers were, pain medication, which didn't help, and an anti-seizure medication. And we had to up the dosage so quickly and so high until she actually found a little bit of relief, but unfortunately it made her like a zombie. So she went from this ice hockey star person to being in bed, not able to move, not out of school. Her life was basically over and she was just like a zombie. So I decided this was not going to be my daughter's future. And sometimes the power of mother's love can be very, very strong. And I started researching, and I was just sure I was going to find something. And I did come across in Russia that they were using laser therapy to regenerate nerves. And I was very lucky to find one place in South Carolina, Myrtle Beach, where she received laser treatments. I called them and they had experience with that. We right away packed our car up and drove up there, and she spent 2 weeks there. And after those 2 weeks treatments, she actually recovered. She was going through, different moments where the pain increased a bit, but then it decreased, and just these ups and downs that are very normal. But at the end of her 2 weeks, we were able to get her off all her pain medication. She was able to go back to her school, slowly, obviously, but she was able to get her life back. And by that December, she was practically pain-free. And the most beautiful thing of that is just that, this tragedy has now turned into, something positive, because when she recovered, I said to myself, there's no way I can go back to a normal job when I know that there's something out there that can help people who actually are committing suicide because they have such a painful reaction to this TN. So I decided whatever it takes, I need to raise awareness. I need to do something. So I became a spokesperson for the TN community. I flew right back up to South Carolina, got trained, continued training. We got financial help. And in 2013, May 9th, 2013, we opened up our clinic in Boca Raton. And it's just been an absolute fabulous journey since then. We've helped so many people. And as Dr. Arzhan mentioned, in 2015, I came across Radiant Life Technology, met Garrett and Avril. They have been an amazing support to us anytime we have questions or we need anything. And we have grown very close, and we all have the same passion to help people in a non-invasive way. We don't want to cause harm, but we want to really help people. And we understand that the body can self-regenerate. And the Delta device using the coMra therapy is an amazing tool. And you're going to see this through this presentation and throughout my presentation as well. So we've treated really countless people with TN and thousands of patients with back pain, knee pain, and so forth, and all using the same technology, the same thought of healing that I'm going to explain to you now. So the next slide, please. Over the years, I've developed something now. So I've started in 2013. It took about 2-3 years to understand that disease is not just your injury or your trauma that you have. There are other things that can contribute to that, such as toxins. Herpes zoster virus is huge for trigeminal neuralgia sufferers because for anybody who has those shocks, those constant shocks, I've always seen that there's some underlying virus, either the zoster, varicella, or Lyme. For people who have more crushing pain, it's very often it's like heavy metals. And then some people don't have toxins, they have more of the traumatic, like an injury that occurred. So it's really something that you have to look at as a whole. Then what I've also noticed a lot that people have emotional issues, not that this is an emotional disease, but you know, when you've suffered for so long and you go to doctor to doctor to doctor and everybody's telling you, well, we can't find anything, there's a moment where you start not believing it anymore. You say, well, maybe it is in my head, or your family starts thinking, well, is it really, does she really have something? It's so hard then to, you know, stay strong and just to say, yes, this is really something that I'm dealing with. And you start doubting yourself. And these negative emotions also have an effect on you. So there's those negative emotions. There's a lot to talk about that because there could also be things. Let's say when Lee went to her ice hockey prep school, we found out very much later that she wasn't really too happy up there. And we thought we were doing something good, that she was going up there to that school. She loved ice hockey, but she wasn't very happy there. And she never expressed that. She never talked about how she really felt. And I see that with many of our TN patients when I talk to them, and we do this neuro-emotional technique where we talk about things that bother you, that you've experienced as a child. We see that a lot of the reasons are they're not expressing how they really truly feel. And those expressions, if you're holding those in, you know, that manifests into pain in the jaw. So it's just really, we have to look at disease, like Dr. Arzhan was explaining, you know, the whole thing, the trauma, the toxins, and the emotions. And that's how you really get the full healing of your disease. Next slide, please. So what I've seen in the clinic is patients that come to us due to dental work, and they've had oral surgery or dental work. Now, it's mind-blowing to me that some patients went to dentists over and over and extracted tooth after tooth after tooth, and the dentist never knew about trigeminal neuralgia. It's just, I don't understand how that system works, but I think now things are becoming more, dentists are becoming more aware, but we really need to raise that awareness that that dentists know if you don't see anything wrong, don't pull teeth anymore, because I can't tell you how many people I've spoken to on the phone, video conferences, that have been to our office that have had so many teeth extractions and they still have pain because it's not in the tooth, it's in the nerve. We've had patients that came from accidents, whiplash. Now, sometimes you don't feel the pain right away, but you have an accident and months later, you actually develop the pain of trigeminal neuralgia. So you have to see, you know, accidents, whiplash. If you've had something like that, then possibly that could have been the root cause of your TN. I had one patient who had a facelift, which is very scary to me, right? I'm never going to do that because maybe they're pulling at the nerve or they've done something. The nerve compression is obviously one that we all know, where you have the microvascular decompression surgery. Then brain tumors, we've seen that. But with, again, as I mentioned, those patients who had those shock pains, usually all have had underlying herpes zoster and varicella. Stress can then bring up that virus that has been lying dormant. And also Lyme disease and co-infections. Interestingly, mold can also affect the trigeminal nerve, not really the nerve itself, but your immune system. So your immune system is down. You're living in an environment that is full, loaded with mold. That brings your immune system further down, and now it expresses itself in the trigeminal nerve. Maybe the nerve gets damaged to the mold or something like that happens. I don't know all the details. I just know that being exposed to mold has been a big reason why some people come to us that have TN. We know multiple sclerosis and TN, go together very often. TMJ and the jaw pain, and then emotional stress, where again you're maybe not expressing what you want to do in life, or you're in an environment that is unfavorable for you. And again, it's all a combination of it all. So our treatment plan that we do in the clinic, if you don't mind the next slide, based on knowing this and seeing so many people and seeing people get better, some people get better, some people don't, it was very important to just combine all of it, because we have people that come into our clinic for a 21-day protocol. That's something I've developed after seeing different people heal in different ways. I tried to put it all together and say, what can we do to help the people as fast as possible and really have a comprehensive healing? So that's how I combined it all. So we do laser therapy twice a day with various devices that we have, but Delta is absolutely included and is one of our favorite devices because it is so gentle yet so powerful. And we love to start gently when we treat, because you want to be very, careful and gentle that you don't aggravate the nerves. So we always use the Delta, start very gently. We do a wellness protocol, so we're addressing the entire body. We're addressing the organs. We're addressing the body. Sometimes you come in with so much pain, or people come in that are stressed, other people that come in stressed, and we want to bring them down into the parasympathetic mode where they're actually relaxed and their body can actually absorb the healing. If you come in all stressed and I'm rushing, I'm this, or you're all in so much pain you just can't deal with it, your body just can't deal with all this. So we first settle you down, relax, see that we can put your body in a parasympathetic mode as much as possible, and then we start working on the issue, on the cause, the nerve itself. So in that 21-day protocol, our patients come twice a day, including once on Saturday, once on Sunday. And we include something called laser energy detoxification. And I will explain that a little bit more. I can't go into too much detail, but I'll give you a little bit of explanation later on in the slides what that is. And then we address the emotions with a neuro-emotional technique and Psyche. And these are very, very easy processes. They're not something that needs years or lots of time. We can literally address the emotional root cause and fix it through the pulses of Chinese medicine. So that also, would take a longer time to explain exactly how that works, but I'm just going to give you just a little brief information. That's how we address the emotions. And then people go home with a poem as a little gift, because you want to continue your wellness. You want to continue, you can help with anxiety points, or if you've burnt yourself, you can use the poem or the Delta. So it's just such an amazing tool that I just want people to go home with it so they can continue their healing. Then the other option that we provide is supporting you when you purchase your Delta, your home device 980 or 905. We assist you with your treatment plan, because everybody's different and not everybody can afford or has time or can come the 21 days to the clinic. So we want to provide help to those who can't. And with the Delta home device, you can start treating yourself. And I do Zoom meetings and text messages and help you put your plan together for your specific pain. And we start slowly and we move up and gradually increase. And usually it takes about, I would say, roughly 2 months, 2 to 3 months, until you feel substantially better. Now, again, everybody's different. So I've had one person who had terrible burning mouth. We did one treatment and the pain was gone. I don't understand how that works, quite honestly. Maybe miracles are involved. But, and we've had patients that after 2 weeks, they feel a large improvement, some after, like I said, 2 months. So with TN, what I found is the most difficult thing for us to do as professionals and caregivers is to tell you how you are going to respond, because there are so many variables. The only thing that I am quite certain that I can say is that we can help you. Of course, here again, there aren't always guarantees, but we've just had such a huge success rate in our clinic. And I know that Radiant Life Technology has had amazing success with all their studies and what they do and offer, that I really feel confident that I can say that we can help you with your issue. If you don't mind the next slide, please. So what I first want to talk about are the expectations, because before I will end, with all the successes we've had, but I just want you to understand how this all works and if there are any issues that could cause you not to heal or just take a longer time. So when people come to me for their 21-day protocol, they usually sign up. It takes about a month until they come to us. I always recommend, please talk to your doctor and please see if you can get off any kind of medication. So like the high doses of medication that you might be on, or if you're on these anti-seizure medications, if you could just reduce the amount or try to get off it. Because when you're on high doses of medication, especially these pain medications, it slows down your system. I'm sure many of you know you start getting constipation. And so it's not just slowing down your digestive system, it's also slowing down your healing response. So it's very important to see if you can somehow reduce your dosage, but obviously with the help of your medical doctor. Don't ever do that alone. So always make sure that he approves and that you're doing this together with someone so that you can get off your medication safely. Now, also extreme stress and poor living conditions. I want to give you an example of a patient that had TN that came to us where we did not have success, because she was with us in the clinic and her husband brought her down, and she stayed for 3 weeks. And during those 3 weeks, we saw amazing improvement, really great improvement. But the last week of those 3 weeks, her husband came back down to visit her and stay with her and then bring her back home. And during that last week with her husband, we could see the tension within that marriage. We could see how he wasn't happy that she was completely pain-free. Like, he expected her to be completely pain. Maybe she was like 60% better, but he wanted her to be completely better and started telling her, well, you should feel better by now. And this is probably really in your head. And just put so much stress in her that her flare-up came back completely. So it's really important to understand that extreme stress like that can continue to stay in that moment, in that trigger. And poor living conditions. So if somebody comes to us and we help them and detox them of mold and all those different viruses and bacteria and so forth, but you go back to a home that is completely filled with mold again, your chances are probably going to be that you're going to suffer again with mold. Your immune system is going to go down again. So it's very important to understand really where's your trigeminal coming from, the bigger picture. Then with patients that have had microvascular decompression. Now this surgery is, I think, about 70 to 80% successful, long-term success for patients who really have the compressed nerve, because they put a little Teflon piece in between and they alleviate that pressure. And apparently there's 70 to 80% success rate. So that's really fabulous. But now for the other 20%, or for those who don't qualify for that, it's better to have, laser therapy, because you're not going to have success if you do this surgery. And some patients, the pain will return because they really never needed that surgery to start out with. Nerve ablation, like Dr. Arzhan was saying, if you have your nerve cut, it's going to really regenerate. So you're still stuck with the same problem that you started with. Severe trauma, that is very difficult. I had a girl come to me and she had surgery in her jaw. Her jaw had been completely basically realigned with plates and all different things. The doctor severed her nerve and she developed anesthesia dolorosa. So She had complete loss of nerve function, and things like that are very hard. We can possibly help you relieve some of the pain, but to tell you that, you'll be pain-free or that we can help you greatly, I would never want to promise that. So those are really the conditions that I want you to look at and to understand where is it coming from, and when I do consultations, I really go into that because that's very important to me that I do not overpromise because this is a condition you don't want to overpromise. And I really want to be truthful with you and help you and see, what is it that we can really do to help you. So those are the few things. And now the next slide, please. I also have patients that ask me due to cancer. They sometimes say, well, if you're regenerating the cells, what if I have cancer? And you might also be regenerating those cancer cells. So that's a good question and a good thought. However, to this day, there are no studies out there that would show or indicate that laser therapy photobiomodulation increases the chance of getting cancer or increases cancer. Now, there's a lot of different areas, right? Cancer, a lot of different areas. It could be skin cancer and different things like that. So we advise don't put it on an area where you have skin cancer. So there's a big, area of discussion regarding cancer. But if you just think this is going to develop cancer, no, there's no studies about that. And I have a picture here of Congressman Jim Hagedorn, and he received a Champion of Healthcare Innovation Award, fighting for quality of medicine. And I attended the World Association of Laser Therapy. I was actually a speaker there, and I spoke about this T3 paradigm that I've developed, and I spoke about trigeminal neuralgia, and he was a key speaker there. And he talked about how photobiomodulation, laser therapy, is, really becoming hugely used in all sorts of areas, and also in patients who are suffering with cancer, who are in a lot of pain and who are going through chemotherapy. And the device helps reduce that pain, reduce inflammation, and helps the patient deal with pain, anxiety, and all these different things. So just to show you that we really shouldn't have fear that this is going to give us cancer, cause us cancer, when it's being used in the Mayo Clinic with people who suffer with cancer. So that's just to kind of give you a little bit of information about the cancer. So let's go to the good things, to the fun part of this webinar. So what I see is no side effects whatsoever. So coMra Care Clinic has performed over 50,000 treatments with no side effects. We see interesting things. We see some temporarily pain increase that can occur during the healing, but that's just temporary. Otherwise, there are amazing things that happen. Patients start saying they sleep better. They have way more energy because we're addressing the whole body. We're addressing the systemic reaction and overall pain reduction, the systemic response. Now, what I mean by that is that we had a patient and she was suffering with trigeminal, and we were treating her, and we treat the back of the neck and the shoulders, and her husband was with her, and after about 10 days he came back to us and said, it was so interesting, my wife was able to reach for her box of cereals, and she's never done that before. She always complains of neck pain and shoulder pain. So it was quite interesting that we were able to find out that, there's a systemic reaction. So she didn't even realize that she was able to reach for the cereal bowl and that her pain was minimized. But the husband noticed that, and he was so excited for her. And it showed us that, we're not just helping the trigeminal nerve or the neck, we're helping other areas, the shoulder, we're just helping the whole body as a whole to heal. So the exciting thing is you feel other positive side effects. It's not just what we're treating, but it's the whole body, and that shows you that we're doing a whole body healing. So let's go to the 21-day success story that I had. As I explained to him, I chose these two cases because I wanted to show you one where we do the 21-day in the clinic, and then one patient where we sold the Delta to, and she was using the Delta at home. So we have Megan here. She's female, 50 years old. She was diagnosed with trigeminal neuralgia at the beginning of 2019. When she came to us, she had sharp shooting pain in her teeth. She had tooth extractions, which made the pain worse. It was horrible. One of those examples like I was mentioning before. She was on high doses of pain medication and anti-seizure medications, and they did not help her whatsoever. Her pain level was at a 10 using the VAS scale, so 0 is no pain, 10 is the most pain that you can express. And her triggers were eating, talking, and brushing her teeth. Next slide, please. So she came to our clinic and we did the 21-day in-clinic treatment. She received 36 treatments. So again, 2 a day. You come in the morning, you take a rest, and you come again later afternoon. She received laser therapy treatment with various devices that we have, and also everyday coMra therapy, which is the Delta device that uses coMra therapy. We treated the trigeminal neuralgia nerve, so the entire face. We usually treat both sides, even if your face is unilateral. We treat the cervical and we treat the spine, because my strong belief is that viruses, bacteria, and Lyme sit in the spine. So it's very important to always treat the spine. Then we did this laser energy detoxification. These pictures will just give you a quick overview of how we find the toxins and how do we actually do this laser detoxing. So we have a bunch of boxes with vials that have mercury, lead, arsenic, all these different frequencies that represent this frequency. And when we do this muscle testing, the patient will indicate that they have a virus or mold or bacteria when their arm becomes weak. So maybe some of you have known about this. Some of you, this might be very new. I know it. Some people think that, oh my God, this is crazy. When I spoke at the World Association of Laser Therapy and I mentioned this, some were writing in, oh, that's woo-woo stuff. But I really ask you to have an open mind about this, also for other physicians that possibly will be listening to this, because it really works, and we have to see that muscle testing is a big part of this. The big part of finding what's going on in your body energetically. So once we have found and identified these vials, we put them in a laser that you can see in that third picture. The laser becomes the carrier of that frequency, and the frequency then is brought into the body, and it is through the vibration of the light, it is shattered. And the frequency of that specific toxin that you have, let's say mercury, is then released through your urine and through your blood and your stool. And we actually have evidence that the mercury is released. We had a patient who came in, he had mercury toxicity, and his toxic level was 21. And he did a 5-week chelation, and it only reduced 1 point. He did our mercury detox, and it reduced by 11 points doing just a laser detox. So, and we have that on paper. So that's what was very important to us, was finally showing us that this is actually really working. And we had evidence on paper. And then we use a couple of other vials and do a detox on you with those vials, strengthening your body. And so it's a little bit of a process, just takes a few minutes, but there's a process to it that you have to follow. So this patient had mercury, and she had arsenic, she had lead, aluminum. Now, again, she had all those shocks, so it was very logical to me that she came up with herpes zoster virus and varicella zoster virus. Now, anytime we have viruses, we always have to detox that 2 or 3 times, because the virus somewhere is just there and it just takes a little bit longer to detox. If we can go to the next slide, please. We did a daily wellness with the Delta. As I was explaining to you, we want to get the body into a parasympathetic mode. You're just relaxed, you're calm, you just feel good. And so we do this with every patient every day. And I tell patients to do this at home as well when they purchase the home laser. Carotid arteries, the heart, the liver, the spleen, the kidney, the adrenal glands. All these organs work together. Now you see here, there's a picture. I'm using 2 Delta devices. So the patient is getting even more than just the 20-minute treatment, really 40 minutes, because we use 2 devices at the same time. Now, we will sometimes use many devices at the same time because we want to give you as much energy as you can in your body. And you might see some, if you do some of your research, you might see that some clinics or some laser companies or professionals say, you know, you can overdo laser, you can give too much. I tend to disagree. And the responses and the successes that we have in our clinic will support that, because we will treat people with lots of energy, sometimes 3, 4, 5 devices at the same time for 45 minutes, and the patients are getting healed. There have never been any side effects, nothing like that. So I am really a strong opponent of saying, you know, you've got to give more energy to the body, more laser time. You've got to like really, you know, bombard the body with this energy twice a day, so the body never has time to go back into like a stage of where it doesn't have enough energy to heal. So my conclusion is the sicker the person, the more energy you give. And that's why the Delta is so fabulous, because it is so gentle that I can give that much energy. The body will just know to take all that and to bring it to wherever the healing needs to occur. The next slide, please. So the results for Megan were she started reducing medications after her first few days of treatment. So she was just on a tad bit more of medication, but she had come largely reduced. She was able to reduce all of it. She enjoyed eating food after 2 weeks. I still remember her walking into the clinic smiling and said, I was able to eat breadcrumbs on my salad for the first time. She said she always loved those crunchy breadcrumbs and she could never eat those because it would always cause a trigger. She got 80% pain reduction after her last treatment when she left. And that's what we see. You're not going to be fully recovered by the time you leave us, but often at least, you know, 50, 60, 70, 80% better. But your healing continues for another 2 months, because your body now, I look at it this way, our body's a garden, and if our pain is like all the weed in there, and if we pull out the weed and we now plant new seeds, it's going to take a little while for those new seeds to grow. And that's how I like to explain it. So what we've done is we've pulled out all the weeds and we've, you know, given the earth fertilizers, and now you're going to go home and these new seeds can start growing and your body can start healing. And this is what happened with Megan. After 6 weeks of returning home, Megan was 100% pain-free. She had no more attacks. She was off all her medication, and we still text on a regular basis. Every couple of holidays and so forth, I'll say, hi, how are you doing? And to date, she is still pain-free. So this was just a classical, typical, amazing example of someone who had no surgery, no pain. She had those typical shock pains, so I could detox of the virus. She stayed for the 21 days. She really, you know, committed to herself to coming here and doing this for herself. And that is when you really get the best healing. I've had patients with TN that live in Boca Raton. And I tell them, please do the 21-day. Just go to a hotel, just get away from your family and friends and your work. And they just can't. I understand that you can't do that, but we just don't have the same results, because the patient's only coming once a day. Then maybe they can't make it because they have to bring their kids to a soccer game. And now maybe the husband has a meeting, so she's got to go there. She's got to go cook, and she's in stress. She's constantly in stress. And it just doesn't work as well when you don't give your body the full allowance to just heal and to come into a hotel, to rest, to have good nutrition, to take your time, to just really deal with what's going on in your life, especially when we do the neuro-emotional technique and we talk about things that are going on in your life. You need space to process that. You need to really understand, what am I doing? What is healing? What is going on? What is disease? And when we do this all together, where we're, of course, your disease manifests into something physical, or if you've had trauma, again, you have that trauma, but you need to address all three together. So when you take that 21-day and you really devote yourself to healing, that is the best result that we can have. So let's look at the next case where we were, oh, sorry, no, let's read her testimony. I'm going to have to put glasses on for this. So this is in Megan's own words. So Megan writes here, that was about a year ago. She writes, Leslie and Carmen Care were truly a godsend for me. I was suffering excruciating electrical shock pain from trigeminal neuralgia. taking toxic doses of anti-seizure meds that left me in a zombie state, and still suffering horribly pain, and unable to chew any food for almost 6 months. I learned about the clinic on a Facebook group, and after calling Leslie, I immediately knew I had to take this opportunity to heal. See, that's what she did, right? I was warmly welcomed by Leslie, Lee, Heather, and ushered into their beautiful, serene, and pristine clean clinic. It was clear from the start that the entire staff truly cared about my well-being and comfort. The effect of my 21-day treatment were outstanding. Within a week and a half, I was able to eat food again and go off my debilitating meds. It's now almost a year and a half later, and I am still pain-free and able to eat whatever I want. This treatment was nothing short of miraculous for me, and I will forever be grateful to Leslie and Carmen Care team for giving me back my health and sanity. Although I had to travel all the way across the country for this treatment, I would do it again in a heartbeat. So that's a beautiful testimonial to also give you hope, that there is hope, that you don't have to suffer like this, that there is a solution. So let's go to our next patient. And this is Anita. She received the Delta home treatment. So Anita was in Miami, and her family called me because actually her neurologist, who at the time was our medical director, was prescribing her medication, and she had reached the highest dosage possible, and she just couldn't take it anymore, and she was really just about to end her life. She was 97 years old. She had been suffering for 35 years, the poor soul. 35 years of this, and 97, and she was just done. And her family just said, we have to try one more thing. So this neurologist referred her, and she couldn't travel. She couldn't come up to Boca Raton. So I decided to take the Delta down with me, show the family how it would work, and show them that this would be a very good option for them. So when I saw her, she was just this beautiful little lady, just sitting in a corner. It had to be dark. She didn't want anybody around her. It just was dark in a chair. And I started looking, talking to her, seeing what was her condition exactly. And I wrote a prescription out, like a protocol for the family, where to treat, how to treat. And she started weaning herself off that medication with her doctor, her neurologist, and she had to treat herself several times a day. We started very gently, just like 2-3 minutes, because her pain was so excruciating. I didn't want it to, trigger even more. So we started very gently, and within a couple of days and then weeks, things really started to get better. It was just amazing how she was able to heal from these 35 years of pain. And that's when people ask me, well, am I too old, or have I suffered? I've suffered too many years. Nothing's going to help me. I always bring up Anita. I say, no, 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 none of this. This woman suffered 35 years with the most debilitating pain, and she's 97 years old. If she can do it, there's still hope. So I always bring Anita up, because this is just beautiful that she would, it's such a strength, and the love of the family being there and supporting her and taking care of her was just beautiful. Her triggers also were eating, talking, and often she had no triggers at all. She just had pain, constant pain. So the next slide, please. So she had daily treatments, as I explained here, just a few treatments a day, started very slowly, 1 minute, 5 hertz. And when you purchase the Delta, the Radiant Life Technology team helps you, or I help you understand which setting to use for what location. And we gradually increased until she had 20-minute treatments twice a day. So I stayed with that 20-minute treatment twice a day. She was able to, very slowly get better and better. And within a few weeks, she reduced all her medication. And within 3 months, her pain had subsided to 90%. So she had 90% improvement. And she became completely pain-free a couple of months or weeks later. I'm sorry, I don't know all the exact timing on this patient, because it was just more phone calls and texts and so forth. But she is now completely pain-free, and she just occasionally treats herself, very occasionally. Sometimes she doesn't have to do that at all. And what's interesting here, though, is because although we say, you have to get rid of the toxins and you have to do the emotional component, this patient now had no NET, and she didn't have the detoxing. So for this patient, she just used the delta. So does the delta also help reduce toxicity and so forth? Because I was telling you also do the spine and just help your organs. Very possible. Maybe this patient didn't have toxins. Maybe it was also the love. She had such a beautiful family, as I mentioned before, helping her, treating her, being with her, just such unconditional love. That love can be healing as well. That could have been the emotional support. So I don't know. I don't know all the answers, but this patient was able to heal just using the 980 delta at home. So let's see the next slide, please, because you're going to see the picture of Anita, and I'm going to just read here where she sends us a text. So this was a text I received. You see here, she has on the left, she's at her 101st birthday, and she's smiling. She's eating ice cream cake, which many of you know when you have TN, you cannot eat cold. She's eating her ice cream cake, her beautiful family there. And her daughter always writes me every holiday, and she wrote here, "My dear friend, what do you think about Anita on the beach with 102 years old?" And again, for you who suffer with TN, you know that wind, cold, anything like that can be a trigger. It doesn't have to be, but very often is, and it was for her. So after all these years, she's finally out there on the beach, enjoying her life, eating cakes, having hugs, and just it's just fabulous. It's just such a beautiful, beautiful story, and I'm so thankful to Radiant Life Technology to have made such a device that is available to everybody and that I use in my clinic. So I'm just so blessed to know everybody and to be here. So the next slide, please. I want to address something that I find is very seldomly addressed. And this is to the TN caregivers. So this is for you who are listening, to those listening that deal with somebody who has TN. I really understand what you're going through because I went through it with my daughter. And it's understandable to feel guilty because I felt terrible guilt. I felt guilty that she had gone to a dentist 6 months prior and I saved a little money because he was cheaper. Was that my fault because she now is suffering with teeth? Did I make a bad choice with that? Should she have gone to a better dentist? I later realized that, she didn't really want to go to that school. Had we not forced her, would she have not suffered like this? I understand when you start feeling hopeless and frustrated. I went to my doctor, her neurologist, and when I told him that, listen, you're just increasing the medication. What else can we do? He just said nothing. That's it. That's her life, either surgery or medication. And what was even more frustrating is when I started surfing and I found that laser therapy was being used in Russia and could be helped. And I brought it to his attention. He was not very professional about it. I thought he could have been more open and be more appreciative and listen to what is there. What could there be? Maybe there is something. Let me listen. I'm a professional. I treat trigeminal. No, unfortunately, he snipped at me and said, "Oh, you Google moms, you think you find answers on the internet." He said, "If there was something out there, believe me, I'd know." Well, thankfully, I listened to my motherly instincts and I followed my gut and I went to this place that offered trigeminal neuralgia treatments with laser. And my daughter got healed, and so did many other people after us, and many people are going to get healed because of this. So I got very frustrated, very, very frustrated that there's not more information about this. And it's really not the doctors. It's more our educational system. I think it needs to be, taught in every single school. You need to learn about this. And that's why this seminar is so important. The awareness needs to be raised. And so I can understand if you're frustrated and there are no answers out there, because there are very little answers, because as I mentioned, the professionals themselves don't understand it completely. We who are dealing with this all the time, very hard for us to understand. Why are there so many variables? And you also really have to understand that your person that's suffering, you see them smiling one moment and the next, they're in excruciating pain. And you don't see the disease. That's what makes this so frustrating. You go to the physicians, you go to dentists, nobody sees anything. They said, "There's nothing on the x-ray. We can't find anything in your blood test. There's nothing swollen," yet you're screaming in pain. So for us caregivers, it's terrible. And people start thinking, well, is it in their head? Does it really have anything? So please, 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 one thing, do never, never believe that. Never give up on the person that you're with. Believe that their pain is real, no matter how many people, ask that question, is it really real? Is it really happening? Believe them. Be their person, that they can come to you. And also during attack, this is something I didn't know and I had to learn afterwards. Like during attack, you want to hug somebody, you want to be there with them, you want to support them, but that's the last thing somebody that is going through an attack wants, is for you to be close to them, because any touching or noise or anything like that. So if they're with you, turn off the TV, dim the lights, just be with them in the room and just lightly tell them, I'm here with you until your attack is over. I'm going to be right here with you. Just don't bombard them with questions. Are you okay? What do you need? Just leave them in their space, but be with them. And also never give up hope that you will find a solution. So let's look at the next slide. Sorry. I'm sorry, I'm getting emotional. All right. Okay. Sorry, put myself together again. So there is hope. Your body can heal and you can understand the root cause. You just have to address all the aspects of a disease. And I want to show this to you because this is Lee. She's now 90%, 99% pain-free. She works full-time, no medication. And she's on the ice. She played this year for the Chile country because they didn't have enough players. And she got silver, and she played, she got the most valuable award. She scored 19 goals. And she's enjoying a beautiful life, playing hockey and working in our clinic, thanks to laser therapy and thanks to finding this. And it just always blows my mind, and I'm just so thankful. And I just want you all to know that there is hope. So thank you very much. Thank you. So if you have any questions, I'm here to answer them. You can send me an email. You can write to the Radiant Life Technology team. We're all here for you, and we're just, wishing you the best, and we want you to know that we're here for you. So thank you again very much, Arzhan and Garrett and everyone.
Thank you, Leslie. Okay. Very, very
Sorry,
touched.
I got a bit emotional. I'm sorry.
Well, that's because, we come together.
Right.
And that's what our first idea was, we have these experiences. You had that experience, my aunt had the experience, and we know now so many people who had that experience. So we just felt, but why don't we share it? And
Right.
we had that Facebook group is now 14,000 people there.
Wow.
And every first comment would be, what can I do? What can I do? So Leslie, thank you so much for jumping in, for sharing your stories, for your clinical experience. Thank you. Just such a fantastic
You're welcome.
presentation.
It was my pleasure. Thank you so much.
Okay, so let's answer those questions that we have from the people who are attending now. And if we'll have time, we will also try to answer questions that came before the webinar. I have like 100 questions almost. So, Leslie, I will address mostly to you, because what we want is to understand, what's happening, what's, actual clinical experience. So I'll stop
just to
here.
let you know, we don't see your picture.
Oh, okay. Sorry. Okay, thanks, Garrett. Okay. So, but do write down the contact information. If you have to go, if you cannot stay, or, if you need help now, this is email of Leslie. This is her office phone number. And above there is a email, info@coMraTherapy.com. So please do get in touch if you need help now. You cannot wait. You know, maybe we can do something now. Next webinar, we will address more questions. So don't get despondent if we don't get to you today or to all of the questions. But I'll stop sharing now slides and rather have a conversation. Let's have a, you know, what has came up.
Ron, I can read a few questions from the chat just to help start with answering those.
Sounds good.
Okay, the first question is, have any of these examples had prior procedures like MVD, cyberknife, rhizotomy? Would those preclude from the treatment or results? A question from Sarah.
What would
Do
you
you want me
say?
to answer that, Arzhan?
Yeah, please.
I'm trying to see, and then you can answer from yours. So what we've seen is that if you've had severe, trauma like nerve ablation, or if you've had that vascular decompression and it was not your root cause, then let's say it's more shocks, then the detoxing can largely help. And we can still help you reduce your pain. But if there's that Teflon piece that's still in there, sometimes that can cause your body to react to that, and it can still cause a lot of pain. So the outcome can still be there, but it's harder for us to say, oh yes, you're gonna get better, because we just don't know. There's that, your body's maybe trying to fight that Teflon out, it's reacting to it, or if that nerve has been severed and there's complete nerve damage there, it's a little bit of a harder situation when those things have occurred. But what we have seen is we can help you minimize the pain. We can help you reduce the inflammation that's maybe being caused. We can help you, get a better grip on these things. So we can help you, but it's maybe not as favorable as if you hadn't had any surgery, if that helps your question. I don't know if Arzhan, if you want to add to that.
Leslie, well, regarding these issues, I will just refer to you because, we had a patient in our center, only one lady, and she had a prior, I believe it was MVD surgery. So she did had improvement, partial improvement.
Right.
After going through, she had, I believe, it was 2 courses in our center. So she had a partial improvement, but not complete.
Mm-hmm. Right. You see, that's what I see too. Some and partial improvement, but not complete. Yeah.
Yeah. But to add to this, you see, when we talk about coMra therapy, what's important to realize is that it's a long-term process because the nervous tissue can regenerate, but its ability to regenerate is limited. It's not like skin, for example, or like liver, when extensive damage can be rebuilt through the regenerative process. So nervous tissue can regenerate, but it does so very slowly and maybe incomplete if the initial damage was very extensive. So the answer would be, by all means, start the process.
Sure.
And then see, maybe it takes 6 months, maybe it takes 2 years, but then see to what extent you can rebuild the tissue.
Right. And it'll help with the inflammation for sure. It can also help you, the anxiety and different things. It'll help build your immune system so that you can fight this off better. So will definitely be some improvement.
Oh yeah, absolutely. And we have to talk about, the general state of being, the exhaustion that the person is experiencing as a result of trigeminal neuralgia. And when you do a systemic treatments, when you open the coMra user guide, you will see universal treatments, and they help to address the general exhaustion at the energetic level, at the immune level, to achieve balance in your endocrine system. So again, I'm not going to the details, but we're really looking at creating the most favorable systemic condition because it's not just the nerve. Now we have to address the entire body, all of that.
Yeah.
Okay.
Another question, Leslie, I live in Denver. Do you know of treatment center similar to yours in Colorado? If not, how do you communicate home treatment plan, or how you use treatment plan?
Well, unfortunately, there aren't many places that do this photobiomodulation to start out with. Then there are even less places, or actually I don't think any really, that know about trigeminal neuralgia and how to treat it appropriately, or that do this combination. And for that reason, why, the Delta is so fabulous, because anybody in the entire world can have this device at their home, and we offer support. We offer support, so how to treat and how to process, what's going on and what areas to treat, and so that's what we do is we offer support when you purchase the machine, and we're there for you.
And just to emphasize that point, second webinar will be dedicated specifically to treatment protocols, how to address different variations, different complications, and Garrett will be mostly talking about the specifics. I also would like to mention we received maybe a dozen questions before the webinar with very specific conditions, like very, very peculiar. So I think what we will do is that we will reply in writing, because we have your emails with your question. So we'll reply to you in writing via email, because some of your questions are like highly specific and we just need to address it, just on case by case basis. There is no like general rule to it. So we will reply by the email.
Yeah, that's what makes trigeminal so difficult, right? Because if somebody has a knee pain, we can just say exactly where to treat, and it's easy. But the TN, there are just so many variables and so many different things that could be, leading up to this. So that makes it a little bit more complicated.
But also, when we're talking about neuropathy, which is damage to nervous system, or specifically peripheral nervous system, quite a few people asked about, what if I don't have, let's say, neuropathy of the facial nerve? What if I have neuropathy in the legs, in the arms? It's a diabetic neuropathy, and so on and so on and so on. So generally speaking, the same principle would apply to a neuropathy of the different nerve.
Mm-hmm.
In other words, we still will be addressing the injury at the cellular level of the nerve itself. So we need to apply coMra, the device, directly to the injured area. It will be slightly different from the trigeminal neuralgia. Let's say the facial nerve. The protocol is slightly different because the area is slightly different, but the concept is the same. It's the gradual regeneration of the nerve, and then we'll see recovery as nerve rebuilds itself. You'll have gradual restoration of normal function. And it's, again, car accident, trauma, metabolic, like diabetic, for example, polyneuropathy. It could be infection, like, for example, post-herpetic zoster, exceedingly painful, another condition. We also have seen very good results. So in the next webinar, we will touch on other neuropathies as well. Okay, Maxim, next question.
There was exactly question on touching also on question on peripheral neuropathy. For example, one question was, I have peripheral neuropathy in both my legs and arms for almost 24 years in my legs and 10 years in my arms, and had already 5 sessions with coMra. And my pain at this moment is still the same as before. What do I expect? How many sessions I have to do, and so on?
Very good question. Again, without knowing specifics, you can't say exactly, but listening to you now, Maxime, to this question, when you had the condition for years, we are talking about extensive damage to the nerves, extensive. So rebuilding the nerves, the peripheral nerves, will take time. We're talking about months, isn't it, Leslie?
Yeah, absolutely, for sure, months. And as you're saying, why do you have this condition to start out with, right? What's going on underlying? So you maybe need to see how to address that as well. But yes, for sure, months, I would say so too. And just 5 treatments is really not enough. And is he treating himself, or is he going somewhere to get treated? Because how long are the treatments? Where are the treatments? That all plays a big role, you know, especially how long are the treatments?
And if I may add to that too, if someone has a really long-standing condition, basically the body goes into a holding pattern to survive. So that means its ability to adapt and change, and that includes healing, is very, very severely impaired. So part of this systemic, and why we keep focusing on that, is if you can picture, you know, if there's a really large sound like a train going by, you kind of suppress your nervous system so that that energy doesn't overwhelm you. So the same thing with a chronic illness, the system starts to get suppressed so that we don't get overwhelmed. But that creates a really, let's say, brittle state of physiology. And to change that to be resilient and fluid and adaptable is part of the healing process in order to have the energy and reserves of the body to regenerate the nerves. So it's not just, let's say, if my arm was numb, you know, with neuropathy, and I just treat the arm. Like Leslie said, there's a systemic thing that needs to be addressed here in order to give the body that facility to be able to heal, which gets into a longer term process. But then it's not just symptom relief, it's actually the regeneration, the body regenerating itself. So I just wanted to add that because it's so important. Thank you.
Thank you, Garrett. Maxime, I think Donna was raising hand quite a few times. Shall we?
Yes, this is exactly what I wanted to mention.
Okay.
So, hi Leslie, hi Garrett. I have communicated with you a lot with TN, trigeminal neuralgia, and I have all 3 devices now. I have the Palm, I have the 980, I have the 905. I haven't used them on my face for a long time because I totally believe in the laser, because I also went to Myrtle Beach, and that's what gave me a 7.5-year remission. And I've talked with Leslie when I got I think the 980 is the one I got, and did the protocols, and I did it for a long time in the systemic. I'm in the States now, and I don't even have my laser with me. I have the Palm. I still have the TN. I'm like 90% better, but I still get attacks. I'm on medication. My biggest thing, I did the systemic for a long time, but every time I did the face, it would aggravate it, and I knew that might happen. But because as you know, the fear is so intense, you stop. So then I communicated, I think it was with Milan, and then I got the 905, thinking, okay, if the 980 helps, 905 will be better because it's more power. And I think my question is for both of you. I still definitely wanted, if I could come to Florida, I would come right this minute, but I can't. I just need a little reassurance that if I continue to do that and overcome the aggravation, I guess basically what I'm saying, and I hope in the next one, like you were mentioning, you will show the protocols. Like I know you showed me the points here and here and here and along here and along here. I guess I just need reassurance. Just do it again. And if you're going to overcome the aggravation, that it can stop. Like I said, I'm way better, and I've overcome a huge amount of the fear of TN because I am better, but it's still there, and it would be lovely to be totally free again.
Are you having shocks still? Is it more, how does the pain?
So I am not having the major shocks anymore. I have pokes, like even just now, and even talking about it, it's like somebody is poking me. It is the TN. It's like right in here. Sometimes it's touching the lip. Sometimes for a long time it was in a tooth. And fortunately, I didn't have the tooth removed because now it's not in the tooth anymore. It's not like just now I touch my lip and it is sometimes the shocking pain, but it's usually the pokes. And if I don't aggravate it, if I aggravate it, it's poking. I don't know how else to describe it. And like I touch it or lick my lips, it will go into a shocky up here.
Yeah, I think if I may say, I think we had discussed, right, to try and see if you can get anything antiviral. I think we discussed that, right, to
I
see if you could,
tried that.
and that didn't help you at all.
No, I'm almost positive that viral is in there, but the antiviral.
Olive leaf extract, that we had said is very good. It's something natural to try and just see if you can, help with that. I'm working on something, on a tool that I can, because exactly for this situation you can't come to us, and there's just limited, right? What we can do is actually trying to put together the laser so I can send it over to you so you could detox of the virus, so that people could start doing this on their own from home. And because I believe the detoxing would really help you. That's unfortunately just one thing that's important, since the device has helped you so far already, which is fabulous. But there's just that little bit more that needs to be done, which is probably that detoxing of that virus, the laser energy detoxing.
So are you saying that you're developing something where I could do that at home? Because
Yes, I'm trying to do
I
that.
watched your thing on that and I think, yeah, awesome.
Yeah.
But I can't. Okay.
Yeah. For that reason, so that we can help people even from at home to just be able to do the detoxing.
I have totally, I've like advertised your Delta. I've talked with Garrett a lot, often on this, and I've watched you, Dr. Surazakov, many, many times. I've watched all of your webinars, and I can say that the laser has helped tremendously. I totally, totally, totally believe in laser. And then on myself, it's because of that last fear that I haven't overcome of the aggravation of it again. I think I just need to repeat those protocols and do it like I was doing it faithfully in the beginning, talking to Garrett, talking to you, Leslie. You're the one that I bought it from and got the initial information. So I'm totally into it, but I just need to overcome that fear again to do it. But I'll be interested, and I will definitely do that viral detox with it if I can, and see if that would be like the last link, because like I said, I'm so much better.
Good.
That I can live now without the fear of living. And even though now I have these pokes, I don't stop doing whatever I'm doing. I just, okay, go on. And you can bite through and it stops.
Yeah.
But I don't have those, like you described, the shocks that your daughter had. Those I had in the absolute beginning. So I absolutely know. And that is a horrible fear that's associated with the TN. You want to stop doing anything. But I don't have that now. And the laser is what has really stopped that. Like I said, I'm on medication. I'd love to have the courage to go off the medication. I'm on the lowest dose of, not the lowest dose of Lyrica. And I think I could go off, but I'm in a super stressful situation. Now I'm with my sister whose husband just died, and so I'm afraid to go off. So once I get back to Czech, where I'm going in a month, and can settle down again.
It's good that you realize that stress could cause something. It's good. So just, maybe do the wellness, use your Delta to the wellness to, do it here on the REN 22 to reduce stress. The Delta is amazing on just reducing stress. On your kidneys, support your organs, do your carotid arteries, do those things to just, on the Delta is a fabulous app. I'm sure you know the user guide app.
I do have
go on there. And just pull them up and see in Universal, which one will be the best one for you to address what's going on in your life now. And just follow that, and that will be, definitely a help for you.
Okay, thanks so much. Yeah, and I'm really looking forward to getting that detox thing.
Okay, good. Thank you.
Thank you, all of you. I love you. I love
you,
I love Delta. Yeah.
Thank you for sharing the experience.
Donna, I'll just add one thing too that you could do in the meantime. When you feel, I'm not suggesting it right now because you're in that stressful situation, but when you get home, when you're using your delta, you don't have to put it straight on the skin. So hold it out. Now, once you hold it off your skin, I'll advise you to just close your eyes, you know, but you can hold it out, say 3-4 inches away, and that's going to reduce the strength. Because for me, when I had this tooth issue recently, before I had the tooth removed, I actually couldn't put the delta on my face. The face was really like shocks, like you say. Well, maybe not shocks like TM, but quite painful. And also just the strength would aggravate. So I was actually treating from out here and I found that soothing. So that's a strategy you can try as well. There's different strategies, you know. So just when you're in a situation where you can take more of a risk with that, because I know you're with the aggravation. And also there was a question I think in the chat, just to go with that now too. Someone asked about we've had some people with well, let's say they went for certain shots and there's some aggravations and we're getting people with a type of trigeminal neuralgia resulting from shots. And those people, it's very, one day it could be here, one day it's somewhere else. It's all over the place and very hypersensitive, and having to use even just the palm and keep it like 4 or 5 inches away, and they can feel it. Just they're so sensitized. So yeah, there is it can be a strategy depending. It's a slower process, of course, because like Leslie said, you know, you start at, let's say, generally 2 minutes and then work up to 20. So this could be starting from you know, 3, 4, 5 inches away from the face, and then slowly after a while you can even make contact. So it's a slower process, but still the same principle of the gradual incremental increase, where the nerve is now strong enough, the body is resilient enough that it can heal that little bit further, that it can, you know, has more adaptability. So just to put that in your percolator, yeah.
Yeah. So are you saying that really the closer and the stronger, if you can stand it, the better? Like the more laser light, like I have the 905 as well, but I haven't used that one on my face. I use that on the other. But the more, if you can stand it, the more and the closer and the stronger, the better. Like my grandma said to me when I was a little girl, I think if a little is good, that more is better, and sometimes I overdo on some things, but
sure,
is more better?
Not necessarily. It's not that it's, we want to support the body to the best way we can, but that also means respecting where the body's at. So of course you and I, we want things to be, you know, done, and which makes sense, but then the body has its own speed. So really this is part of the healing, is developing this relationship with one's body of where the body's at and what are its needs. So then it's not so much about more or less, it's more about how do I navigate this relationship? Oh,
I think that's the hard thing. I don't know how to navigate that, but
yeah, I mean, it's a huge journey. Yeah, we're all on that journey.
Yeah. Thank you. I don't want to take any more time. Thank you.
Okay. Yeah.
Thank you, Donna.
Thank you.
And nice to see you. Yeah.
Nice to see you too.
How are we doing, Maxime? More questions?
There are some more questions on various topics. We can briefly also touch on that one. A question is, for example, a little bit different condition is consequences of multiple sclerosis and epilepsy symptoms. What kind of experience do we have with epilepsy symptoms, and whether it is okay to use coMra, whether it will trigger epilepsy episodes, and so on?
Well, that's big, huge topic. Brief answer, yes. But Leslie, you wanna?
With epileptic, I have not had any experience
Okay.
at all, but with MS, I was treating a patient who had trigeminal and MS, and he was actually having brain scans done every 6 months. And because they always saw these lesions and they were apparently getting worse, the mom was telling me. So he came in for treatments, and he lived in Florida. So we were treating him over the course of about 2 months, every couple of days. And what was very interesting, the mom came to us about one of the last treatments and said her son had just had a scan again. And the doctors came in to the room, like several doctors came into the room with the results, and they all like looked at her all perplexed. They said, "What is he doing? Is he doing something else? Like what is he doing right now?" She said, "Yeah, he's getting laser therapy to the brain. We were using the delta as well." And they said, "Well, we don't understand this, but the lesions are getting smaller. There are less lesions." And they couldn't understand that because they were saying what they should normally be more, and what is he doing to have less? So I tried to contact them to talk about this and get information. I never got a response, but so that really showed and was proving that it was helping actually the MS. The brain was having less lesions after 2 months of laser therapy. So it would be really interesting. We just have a limited time, right, Arzhan and everybody? We just have so much we want to do, and there's just so many few hours in the day. It would be fabulous to do a study on this, because we know that the delta and the laser devices, they really have huge stimulation to heal the body, or the body heals so well. And there's so much more that needs to be done, and research that needs to be done. But I would say don't be afraid if you have MS to use it. It can only, in my eyes, and what I've learned about it, can only help you.
Well, with MS, actually, we have very detailed reports from South Africa.
Oh,
And
wonderful.
Charles, he's here. He's a representative of South Africa. And he shared with us amazing, amazing stories of people who had MS for a very long time, and how successfully they used it. So what we will do, we will send you the links because we have the interviews actually with them, and we have the case stories written down about people with MS who used coMra therapy. But again, it's the same idea, you see. The loss of myelin sheath, which is what's happening in multiple sclerosis. So with MS, it's happening in the brain. With trigeminal neuralgia, it's happening in the peripheral nerves and so on. But again, it's the same principle. If we help the nerve to rebuild its own structure, to regenerate, regardless of the cause, we are observing the restorative, regenerative process. And yeah, I agree that we with MS, it's a whole separate webinar actually. But when it comes to epilepsy, I can say for sure, because that's what I've been observing. coMra does not provoke epilepsy, even though I cannot say from top of my head, we've seen like fantastic healing results with epilepsy, but it does helps in overall general condition of the person. Maybe I'll ask Dr. Anna next webinar about the epilepsy, because I cannot say top of my head. We're coming to 2 hours, and I feel sort of we had a very good cover, but the key idea, what I wanted to do at this webinar, is to have you, Leslie, come share as much as possible. So we have it on video, we have the recording. We were asked about, can we read about it, because for hearing impaired. So we will type it out as much as possible, so in written format. And we would like to encourage you to share this information with the TN community. It just goes without saying, if we went through this, if you went through this, and you know what it is, please, please, please reach out to these people. So I would ask to copy all the questions, Maxime, to have them on record, because we will come back on a second webinar, November 15th, and we will try to cover unanswered questions as well. But at this point, Maxim, how do you feel? Any more urgent questions?
I think it's there is a lot of questions, but we need to continue in the next part, and also email follow-ups that we will have after this one.
Okay, fantastic. So we did it in 2 hours. Again, it's really tip of the iceberg, but so far, I mean, Leslie, Donna, Garrett, thank you so much for jumping in. Leslie, thank you for sharing, and thank you for attending.
Thank you so much. Thank you all. Big hug to everybody. Love you.
Okay.
Bye-bye.
Thank you for joining.
Bye-bye, everyone.
Bye-bye.